much. Siobhan and I are so excited to be here with you today to talk about lipedema and trying to solve that puzzle of this really complex condition, a lymphatic and fat disorder, but looking at it from a metabolic perspective. And so here are my disclosures. I do work with the Lipedema Project and Lipedema Simplified. I've written a couple books about using keto for lymphatic and fat disorders, and I have a lifestyle program. And here's Siobhan.
These are my disclosures. I do get Patreon pledges from individuals for independent research. I'm the operations manager of Own Your Labs, and I'm on the board of two nonprofits, the Citizen Science Foundation and the Lipedema Project. And I've also been on a ketogenic diet for 6.5 years, so that obviously biases me towards it.
And I should say, I didn't put how long I've been on keto, so I've been doing that since 2011, in the last 4 years, completely animal sourced, which seems to work better for my patients as well. So what we're going to talk about today, I'm going to talk about what is lipedema. Our big thing we want to do is increase the awareness about this condition. Maybe if you're a medical provider, you'll be able to recognize it in your patients. And you will also be able to recognize it maybe in yourself or your loved ones. So we're going to talk about signs and symptoms, types, stages. We'll talk about the traditional management strategies and how our understanding of this condition vitally changed recently, and some of the preliminary research.
And I'm going to be talking about the primary focuses of lipedema management, so what are we actually trying to address? I'm going to talk about the potential mechanisms of ketogenic diets and why they may be benefiting. And I'll also be talking about special considerations when formulating diets for lipedema as well. And then some kind of information from the patients themselves that I think you'll find interesting.
So what is lipedema? And I show you this one picture, it's one presentation of it, because the women with lipedema can all present differently, but that's the important fact, is that it occurs almost exclusively in women. There were a couple of men who have been diagnosed, but they had a severe hormonal imbalance, so it's almost exclusively appears in women. And so you have that disproportionate deposition of fat to the lower body and sometimes also the arms. In this presentation, she also has obesity, so it doesn't seem as asymmetrical. There is edema, and as I said, obesity is a common comorbidity. One paper had it as much as 88% of women with lipedema also have obesity. And there is extreme hypersensitivity and pain with many patients with lipedema. There's very easy bruising and skin and tissue changes I'll be talking about more. And then one of the most important things that we've been looking at is this limited or no response to diet and exercise. And we started thinking maybe it's just the traditional diet and exercise of very low calorie, low fat diet, and a lot of these women were exercising tremendously and nothing was happening to their lower body. So what is happening is that it may be as many as 11% of women worldwide have lipedema, but they don't know it. They think they have obesity, and this is a distinct condition. So that means, if this is accurate, that could be 17 million women in the US who have lipedema, and as many as 350 million women worldwide. So let's look at a couple of the types of lipedema. And so there was an author in the early 2000s who designated these types of how it presents. Where does the fat present on the body? And so you can see with all these presentations that usually the hands and feet are not affected. And also, typically, if there's no obesity involved, the waist is still narrow. So you can really see that asymmetry. And so type 1, it's mostly around the hips and buttocks. Type 2, it goes from the waist to the knees. Type 3, it'll extend all the way down to the feet. And type 4 is the arms. And typically, the arms will be associated with some other type of lipedema. So this one is showing type 4 arms with type 3. And then type 5 is mostly, it's lower body, but the calves are more severe. And lipedema is chronic and it's progressive. And so you can see the 4 stages here, progressively more severe symptoms until you get to stage 4, when we have a lot of fat deposits. The other symptoms of the pain and the bruising and the edema is much more severe. And so if you progress to this stage, then you can be very immobile and end up being very isolated. So the really important thing is, can we stop the progression? And we do feel like we can. So let's talk about those symptoms just a little bit more in detail. You can see this photo here from a lymphology textbook in 2012 really shows that asymmetry when you have really the upper body is not affected. A woman with lipedema can really look like she has 2 bodies, a leaner body on the top and a much larger body on the bottom. And so you can see in this woman that there's minimal involvement in her head and her trunk and her neck. So, and the hands and feet are spared. There has been some great recent studies that have showed through very high-tech imaging that we do have edema and we do have lymphatic anomalies in lipedema. And this is before obesity is present. So usually in those early stages of lipedema, stage 1 and 2, with women who have a BMI of less than 30. And so we know that obesity itself can cause edema, can cause lymphedema to form. But in these studies, they were showing those impairments and increased fluid in those early stages of lipedema. The pain can be quite profound in lipedema. This one paper in 2008, they interviewed women with lipedema and asked them how do they describe their pain. And you can see from these descriptors that they used that it can be quite severe. We have found that in response to treatment that pain can go away. So just because there's not pain doesn't mean that you don't have lipedema, but unmanaged lipedema, the pain can be quite severe. This is a paper in 1940, Allen and Hines at the Mayo Clinic. They were the first to identify lipedema. And so as that very first paper, they commented on the pain. They said aching distress in the legs is common. And then they went on to say occasionally a patient feels that her large legs have ruined her life. Many are ashamed of her legs. And that was when lipedema was first identified, and we really haven't come very far since then in how we can help women with lipedema. So some of those skin and tissue changes, fibrosis is a big one. So the scar tissue, the fibrosis in the lipedema fat gives it that dimpling mattress-like appearance you can see on this patient's thighs. And so we get that, sometimes that firmness, particularly to the dependent parts of the fat lobules. And there is some evidence that that may be one of the things that resists fat loss, is that fibrosis that is in that fat tissues. We also can feel fat nodules, these hard, grainy balls of fat. Could be as small as like a rice grain or larger, walnut size or larger, that it's typical when we're palpating the fat in lipedema. That's one way we can identify it. And then you can see this patient has a pretty severe presentation of what we call ankle cuffing, so that fat stops abruptly at the ankle and the foot is spared. It can also happen in the wrist if you have lipedema fat in your arm, and you can see that cuff at the wrist. And then also that easy bruising from that hyperpermeability of the blood capillaries, as well as so that increased influx and fragility of the capillaries. So traditional approach to treating lipedema has not been holistic, but has been very much focused on the physical and doing physical treatments, manual treatments with specialized massage, compression therapy, exercise. And I have to say, Europe is way ahead of the US on that. It's been, even though we coined it here at the Mayo Clinic, Europe is way ahead on doing those physical treatments. Now we're starting to catch up. And so we're looking at other things that we can do, especially in the area of psychosocial support and education. So at Lipedema Simplified and Lipedema Project, we like to use this holistic approach of looking at also the emotional, social, mental, spiritual, as well as the physical side of the condition. And then another big area that they've used for treatment of lipedema is surgery. If they progress to lymphedema and have a lot of edema, they might have lymphatic microsurgery, but many women are going straight to liposuction, which I'm not super in favor of, but it does have its place in an overall program. I just think it shouldn't be the first step. So this is when we started to change on how we were looking at lipedema. I had done a small pilot study for lymphedema and obesity, where I encouraged my participants to adopt a ketogenic diet and had pretty spectacular results. I was presenting that at the first symposium at the NIH had on lymphatics. And so I was presenting my poster, and Catherine Seo from the Lipedema Simplified came up and talked to me, and we both considered at the same time, I wonder if this would work for lipedema, because so far diet doesn't work. What we consider to be diet doesn't work, but maybe this would work for lipedema. And so we started thinking about doing that, and we just put it out to the community, mostly through Facebook. Maybe you want to try this. It still was being put out we talked about this in 2016. In 2018, there were still papers coming out that lipedema as fat is unique because it's completely resistant to loss by diet and exercise. So that was still out there, but we were starting to experiment. And we had really no idea what to suggest for the women. So we used what I used in my pilot study, Dr. Eric Westman's page 4. So try this. And they, consult with your physician, of course, but see if it'll help. And they did. They started experimenting, and they started posting their before-after pictures on our Facebook group. So here's one of them who she posted, after 3 weeks of using a ketogenic diet, and you can see that she didn't lose any weight, but look what happened to the volume on her lower body after just 3 weeks. Here is someone else, and this woman actually stumbled upon a ketogenic diet before we ever said anything, before we put it out there. So she had been doing it over a period of about 2 years. She lost almost 200 pounds, and you could see a significant reduction even in her lower body. Here's someone else. She just showed what happened to, it looks to me a largely amount of edema as well as fat in her arm, but about 6 months had a nice response. Someone else, before and after, quite a response in her lower body. And someone else showed that before after. So, and most of these were, about 6 months and showing how they were doing, on how their progress was going. We're pretty excited. So the word started getting around, and so researchers said, well, we want to examine this. So just in the last 2 years, there's been a bunch of papers that have come out about different studies using women with lipedema. This one was a small pilot study. They have another one going underway right now with a much larger group, but this one had 9 women, 7 weeks with a ketogenic diet, followed by 6 weeks with a standard Nordic diet, which is very high carb, and you can see the results that both groups, only the keto group lost weight and reduced in hip measure in that area affected by lipedema. And then after using a Nordic diet, they didn't have any further decrease in weight, no further decrease in circumference. After keto, triglycerides went down, pain was halved. Those 2 things returned to baseline levels after using a standard high-carb diet. And what was interesting is that these things happened, the weight stayed the same, but the pain came back and the triglycerides went up, which told us that there's more than just weight loss that's happening for women with lipedema by using this way of eating. Here's a great case study report out of Italy, 22 months using a ketogenic diet. A 32-year-old woman, widespread pain, particularly in her legs, and they put her on a ketogenic diet. You can see the macronutrient distribution there, and spectacular results. She had never been able to lose weight on her lower body. And now she did with a ketogenic diet. And she could see that she had spectacular results in all areas. This one came out of Brazil. And what's astounding about this paper, 5 case studies, lipedema can be treated non-surgically. This was written by 2 surgeons that do liposuction for lipedema. So we were thrilled to see this, that these surgeons really wanted to put, if you still wanted to have a liposuction, let's put you in a better place before you do it. And so they use a ketogenic diet. Manual lymph drainage is a manual technique, a massage, using supplements and also aquatic exercise. And in all 5 of these case studies, they showed great results. You can see this woman through the 11 months just with that plan, with the ketogenic diet. Then she decided she wanted to have a liposuction. I would bet that she had much better outcomes because she was much more healthy going into that surgery. This is a nice study out of Russia. 60 women into 2 diet groups. It was just a 4-week intervention, but you can see that the keto diet, very low carb, protein actually pretty high, and fat moderate. Fat was pretty much the same in the low-calorie diet, but carbs pretty high, and protein kind of low. And so here are our results. Both of the diets, we had results as far as weight loss, fat mass loss, and total water loss. But it was much stronger with the ketogenic diet. And when you look at their metabolic health with some of the other outcomes, there's no question that they were better off with the ketogenic diet. And then most importantly, on the bottom there, I show that the leg volume size was only correlated with the ketogenic, losing weight with the ketogenic diet. So they lost weight on the low-fat diet, but their legs didn't get any smaller. And then one last study, I think this is a marvelous one that came out of Poland. 91 women, and now it's a 16-week intervention, 2 diet groups. The one group, I would call this a keto group because it was very low carb and pretty high fat. And I really liked how this one, they showed us what the grams were, which we know that it's more important to know what's the mass versus what's the percentage of calories. So that was really nice to have that reported. And the other group was, I would call more low carb. So they still had quite a bit of carbs, and the fat was not that high. So what happened with this? Again, both of them had results. But you can see the keto group was prescription strength results compared to the low carb group. So the low carb may be a good place to start if your patient doesn't want to go straight to keto, but we definitely get better results with keto. And all of those measurements on the lower body decreased. So now I'm going to hand it over to Siobhan to talk to you about her part.
All right, thank you, Leslyn. So now that we have a better idea of what lipedema is and what ketogenic diets can do, I wanted to go into some of the behind-the-curtain stuff, what might actually be happening with mechanisms that might be resulting in these benefits. As much as we want therapeutic diets to benefit right off the bat, the first time and in the first form that we try them, that's not always the case. So if we have a better understanding of what we're trying to do and why ketogenic diets may help do that, when it comes time for troubleshooting, it may end up being easier to think, what else can mess with these things, and what tweaks might we need to make? So before that, I wanted to touch a little bit more on the consequences of poorly managed lipedema, because I think this is worth emphasizing, why we work so hard towards getting this information out. So lipedema does a lot of stuff, and some of that is impaired mobility or loss of mobility. People may have trouble going upstairs or even going on walks, or maybe confined to wheelchairs because of lipedema. This, as you can imagine, can result in poor body image, especially after interactions with society who keeps telling them they're just obese and not trying hard enough. And later stage lipedema, lipolymphedema, so lymphatic complications can also develop, which can result in higher risk of things like cellulitis, hospitalization, and all that comes with that. And of course, as Leslyn mentioned, unmanaged chronic pain can be a massive influence on people's life. And it's not fun. So as you can imagine, all of this contributes to poor quality of life. So this is all of the stuff we are trying to either prevent or reverse if we can. And as you can imagine, the lipedema management areas of focus kind of reflect this. So pain reduction and elimination, prevention of further fat gain, or if the person is also obese, as Leslyn mentioned, this can happen in quite a few cases, reversing that if possible as well, improving metabolic health, swelling reduction and lymphatic support, for reasons I'll get into a little bit later, and then maintaining overall health of the lipedema tissue. In terms of ketogenic diets, one aspect and why they may help may just be that they're really good at improving metabolic health. So that may come into play in terms of weight loss in general, reducing insulin, things like that. And we can see this reflected in terms of reversing diabetes, improving fatty liver, like we just heard about, reductions in insulin, visceral fat, and so on. What's also interesting is that in the study labeled number 2 here, they actually found improvements in metabolic syndrome when using a low-carb diet in a lot more people when they were using low carb compared to moderate or high carb, even if they intentionally prevented people from losing weight, which was also kind of reflected in the previous one, or that was the intention. And there's also impacts with ketogenic diets and inflammation. So we can see this in terms of reductions of inflammatory markers, direct signaling effects of ketones in terms of inflammatory signaling have also been noted, and then reductions in visceral fat, which by some lines of thinking may also indicate reductions in gut irritation and gut damage and gut inflammation as well. So we kind of get this whole body impact. And inflammation matters in terms of lipedema because we actually can see some of those signs. So as you probably know, the cardinal signs of inflammation include pain, redness, heat, and swelling. And the pain and swelling in lipedema is particularly noticeable, but if you paid attention, you might have also noticed some redness in the legs in some of the before pictures that Leslyn showed. There are also things that further support this, including fibrosis of the fat, as well as extensive scarring resulting in the nodules, and not just persistent swelling, but swelling that can be exacerbated by things like food sensitivities or extreme psychological stress, which are both inflammatory triggers, or at least potential ones, and this may indicate that the swelling in lipedema also has an inflammatory component in terms of exacerbation as well. And I won't go fully into this, but all this is to say that inflammation has a huge impact on lymphatic function, and the end result can be impaired lymphatic efficiency, leaky lymphatics, so the fluid going back into the tissue. And Leslyn mentioned, but the lymphatics and even early stage lipedema appear to be working overtime. They're pumping incredibly fast, trying to get that fluid out. So if there are ways we can reduce this inflammatory necessitating environment, perhaps we can help unburden that already struggling system a little bit. And swelling does a lot of things, unfortunately. So one study actually showed that measures to reduce the swelling in lipedema by using management strategies typically used in lymphedema, so lymphatic impairment, actually reduced self-reported pain in lipedema patients. So those two things may play off of each other. And we can also see in some mouse studies, and then also lymphedema again, that fluid stasis in the tissue may also contribute to adipose proliferation and essentially fat gain that's unrelated to how much you're eating and how much you're exercising. And along with this, in similar studies, we can also see that fluid stasis may contribute to this sort of callousing of the fat. And this, when we see it happening in obesity, seems to also correlate with difficulty losing that fat as well. And then just in terms of patient complaints, swelling may also contribute to tight and heavy feelings in the legs. That's actually a sign of swelling. So circling back to metabolic syndrome and just poor metabolic health in general, there may be kind of two factors at play here that may be contributing to this inflammatory state. One of which is that metabolic syndrome is associated with a state of chronic low-grade inflammation, so you might have that at play if their metabolic health isn't that great. And it's even been characterized as an inflammatory disorder, so that may be a necessary component of metabolic syndrome. And the other aspect is post-meal environment. So in this one, they had both obese and insulin-resistant people, and then also lean and insulin-sensitive, and they fed them different diets. So this was just the reaction after one meal. And so it was high fat, high carb, or high protein. And in the obese insulin-resistant people, they not only had a hyperinsulinemic response, so their insulin went super high from the high-carb meals, they also had a hyperinflammatory response to that high-carb meal. They didn't show that with either of the other two meals, and the lean insulin-sensitive people didn't show it to any meal. So this means that with ketogenic diets, we may be lowering that kind of inflammatory state by improving metabolic health, and then that may also consequently lower the post-meal inflammatory environment as well, both by improving their metabolic health, but also just by decreasing that carbohydrate content in the diet. I also want to bring up this because this caught my attention a lot. So with lipedema, there are many signs of connective tissue abnormalities. And so this can range anywhere from increased prevalence of aortic stiffness, loss of tissue elasticity in lipedemic areas in later stages. Hypermobility is very prevalent, so kind of overly bendy joints. And it's 58% overall in lipedema patients in this study, but if you look at it by lipedema stage, so the increasing severity, in the latest stage, it was actually a prevalence of around 80%. So it increased the worse lipedema got. Connective tissue abnormalities have also been connected to some of the blood vessel abnormalities that Leslyn mentioned, including the easy bruising, the overly leaky capillaries, and more fragile blood vessels as well. And then this one, unfortunately, I can't get super into, but it's really, really interesting. So Williams syndrome is this genetic disorder, and it results in a deletion of one copy of a bunch of genes, a couple dozen. One of those genes is elastin, which is part of connective tissue. And this deletion of one copy has been tied to Williams syndrome patients being more likely to have aortic stiffness. And then this other aspect is that 30% of people with Williams syndrome also develop a lipedema phenotype. So they look like they have lipedema. They have that distinctive cuffing. They have the disproportionate fat. So maybe connective tissue differences in a lipedema phenotype and this increased aortic stiffness, maybe those overlap for reasons relating to connective tissue. Connective tissue and nutrition. What's really interesting is there's two reports here that are referenced, and they're both talking about Ehlers-Danlos syndrome, which is a connective tissue disorder, and nutrition. They were suggesting that some of the symptoms of Ehlers-Danlos syndrome may actually connect to vitamins and nutrition, so vitamin C, magnesium, things like that. So on the left here, you can see the nutrients of interest that they mentioned, and then on the right, the symptoms that these may relate to. And on the right, it's actually symptoms that overlap with lipedema too. So if there are connective tissue differences in lipedema, perhaps nutrition may be an important component for that as well. And when we think about ketogenic diets and nutrition, we may just think, oh yeah, increased intake, awesome. But that's not the only thing that may be happening. So for sure, there may be that. For example, carnitine is in red meat, so if you're eating a lot of red meat, you may get a lot of that. And ketogenic diets, if they're kind of being suggested from a health perspective, it may increase dietary quality overall, so that may help with nutrient status. But there are two other things I want to kind of suggest here that may play a role as well. So one of those, pathological insulin resistance. If that is impacting the kidneys, it can actually cause issues like magnesium wasting, so that may kind of factor in there. And then also chronic inflammation may impact things like how much of certain vitamins you need to sustain that response, like folate. And then also it may suppress levels of other nutrients like vitamin D, so that may play in too. So if we can resolve those, maybe that may help nutrient status as well. And nutrient sparing and production may come into play here too. So perhaps through increased intake of carnitine, we may help spare vitamin C. And this is something that's in a paper published by Amber O'Hearn, who's right over there. And then also, low-carb diets may also help us produce our own nutrients like DHA and folate as well. So maybe all of that comes into play in terms of how many nutrients we have and can play with, and then how much that impacts the health of connective tissue, and ultimately lipedema symptoms and progression. Another unknown element, as is not uncommon with lipedema, is the direct effect of ketones. Maybe this is playing in too. So I already mentioned that ketones may have this kind of regulating effect on inflammatory signaling, but they also do a ton of other things. They're really cool. So one of these is, the first two are in mice studies, just for full disclosure here, but in those mice they found that exposure to ketones actually helped signal new lymphatic vessel growth. So lymphatic vessels help remove fluid from the tissue, so if this is also happening in humans, maybe this could be really, really good for lipedema too. And then also, in a separate study, they found that ketones help signal for prevention of fat fibrosis, the callousing type, so not the severe scarring we see in lipedema, but both might be present. And then also, if they got the ketones up high enough, around 3 millimoles, they could actually reverse that callousing type of fibrosis. And as we mentioned, this may actually contribute to the difficulty in losing fat in lipedemic areas too. So maybe this is why on ketogenic diets we're seeing that reduced leg circumference. They're finally able to lose some fat from their legs, maybe because their fat is getting a little bit healthier. And also in lipedema, the fluid stasis from the swelling has also been suggested to make that tissue kind of not enough oxygen kind of situation. And ketones have also been suggested to be protective in this low oxygen environment in tissue, for example, in the brain. But there's actually a really good paper that suggests that in any hypoxic environment where access to oxygen is low, ketones might also be helpful in terms of providing energy that the tissue can actually use. And with all that in mind, lipedema is a really complex disorder, so it should be individualized, especially if someone is still experiencing flares. Like I said, this is kind of the troubleshooting component that we see all the time come up in the community. And I wanted to provide just a couple general things that we see show up. So for one, food sensitivities. So this kind of ties into the inflammation, flare, triggering, swelling type of stuff. Common ones that we see are dairy, nuts, sweeteners, and nightshades. And carnivore diet has also been, in some people, really, really helpful because it kind of reduces all of those and provides good nutrition as well at the same time. So if they're open to trying that, maybe just to see if something else is impacting. And then also, is there a history of chronic calorie restriction? With lipedema, the answer is probably yeah. And in this case, if they're still having difficulty losing weight, one thing to consider is maybe reverse dieting. So eating to satiety to try and get your metabolism back up to healthy levels, preferably with a healthy diet, so a ketogenic diet, for example, at the same time. And then extended or intermittent fasting. Is it appropriate for everyone? Probably not. But one thing that I do want to kind of beam into your brain here is that even though lipedema patients may look fat, they may look like they have a lot of fat, not all of that fat may be functional. So as far as their body may be concerned, they may be functionally lean. So they may respond to extended fasting as if they do not have a lot of body fat. So check-ins on how they're feeling and how well they're responding to it might be appropriate too. Higher protein versus higher fat. I know this is a big discussion point perpetually for decades and decades, but I think it comes up to individuals, and this is kind of what we see as well. So some people do really, really well on high fat, and some people do really, really well on high protein. So generally, what I tend to say is try both, especially if you're still having issues, and see if you get benefit from one or the other in particular. And all that is to say that we're still learning a lot about lipedema, and that includes how it impacts nutrition and what may be best for what person. So being open to some personal experimenting, which I highly advocate for, can be really useful to just get the best possible diet for you that you can. So I gave you a bunch of information, but let's make it a little bit more simplified. With ketogenic diet usage, the main takeaway here is that multiple lipedema symptoms body-wide can be reduced or in some cases even eliminated, like the pain aspect. And this means that need for other management strategies may decrease. You may not need to do things for pain relief anymore if you don't have pain anymore, which is awesome. Or if you do still need other therapies, which isn't uncommon, like manual lymph drainage, then the efficacy of those management strategies may improve. So you may get longer lasting benefits. You may have an easier time holding on to the tissue improvements and things like that. And with lipedema, unfortunately, there is a lot of suffering that comes with it. There's psychological suffering. There is social suffering because of your interactions with others and them not understanding what you're going through, or potentially even blaming you for the situation that you're in. And there can be physical suffering as well. But with specially formulated ketogenic diets, we are seeing that a lot of this suffering can be reduced, which is awesome. So, before we close out, I wanted to touch on one more thing, which is the Voices of Lipedema project. This was a two-pronged approach, but I'm only going to be discussing the video testimonial data, and this is essentially where the participants are telling their own story. So symptoms they noticed before diagnosis, their experience with other people, and just their overall lipedema story. So this is a small amount of people, and it's not meant to be definitive. We were just kind of trying to see what we could find out. And all participants were also enrolled in Lipedema Simplified programs for this, so they were probably biased by that. Okay, first, this is super important because this is likely the stuff that people are going to talk about to their doctors, to their friends, to their family, even if they don't know what's causing it. So the symptoms that they tended to notice before they knew anything about lipedema was things like unexplained weight gain or weight gain that was resistant to diet and exercise, disproportionate fat distribution, so they could have just noticed the shape in their body, or they may have noticed that when they gained or lost fat, that they were mostly gaining in the lower body or they were mostly losing from the upper body. Swelling was also commonly noted, and this included things like swollen ankles or orthostatic edema, meaning they were swelling from long periods of standing, and general tightness and heaviness of the legs, like I mentioned before. It's also interesting to note what they didn't mention. So none of these participants mentioned anything about wrist or ankle cuffing. They just didn't notice it. And the nodules as well didn't really come up. No one was like, man, I have really grainy fat and it's kind of weird. I wonder what that is. It's just, it doesn't enter your head. You assume any texture you have is just normal. But these are both really distinctive for lipedema. So if lipedema is suspected, it might be worth following up on these to see if they're present and if lipedema is more likely. Experience with doctors was largely unpleasant, unfortunately. I won't go super into detail here, but it's pretty much what you would expect in terms of being accused of non-compliance or told to try harder with the diet and exercise that they were already doing, or just told that they were lying. So you can see that in the quote up above. And then half of participants also felt dismissed by their care providers, either when they were talking about their symptoms prior to diagnosis or when they were looking for help after they had been diagnosed. And I think a lot of this is just coming from the fact that they were largely interacting with doctors who didn't know anything about lipedema. So just by being here, you are probably helping to improve this because now you know about it and you can't unknow about it. So I think a large part of this is just extending that empathy and understanding and letting them know that, yeah, we believe you. Lipedema is a thing and it sounds like you might have it. So I wanted to end on this quote here because I think it sums up a lot of people's journeys, but lipedema in particular. And I'll just read it for you. The moment you see your challenges as a puzzle and not a problem, you've found your way out. You may not be able to solve it in a day, nor even a year, but just know that there is always a solution. And I think what we can say with lipedema is we definitely do not have the puzzle fully solved, but we have figured out a lot of the pieces and a lot of what to do to help with the suffering and struggle that people experience with it. And I hope you'll be part of that puzzle solving in the future too. Thank you.
Thank you. Mhm.